My name is Betty, and I was a nurse in America in the 1950s. Every morning, I arrived at the hospital knowing I had to be ready for anything. The uniform had to be crisp, my shoes polished, and my cap set just right. In those days, appearance mattered almost as much as skill. The corridors always seemed long and busy. There was a certain sound to an American hospital then: trolley wheels, footsteps, ringing bells, distant voices, and the steady rhythm of work that never really stopped. Once I stepped onto the ward, I had to be alert from the very first minute. Nursing was hard work. We made beds properly, kept everything neat, checked temperatures, watched our patients closely, and made sure nothing was missed. There were no shortcuts. You learned quickly that a nurse had to be practical, steady, and able to think while moving. The head nurse expected standards, and she was not shy about making that clear. She watched how we stood, how we spoke, how we carried ourselves, and how we handled the patients. You learned discipline very quickly. It could be intimidating, but it also made you sharp. What mattered most to me was the patient in front of me. When someone was frightened, I tried to sound calm. When someone was lonely, I stayed a little longer. When they were unwell or in pain, I did what I could to help them feel safe. That was the real heart of nursing. The nurse's room was one of the few places where you could breathe for a moment. We would sit with a cup of coffee, compare notes, and gather ourselves before going back out again. Those small moments of conversation helped carry us through long shifts. Not every day was easy. Hospitals could be demanding places, and sometimes you felt the pressure from every direction: from the doctors, from the ward routine, from the patient's needs, and from the expectation that you should always stay composed. Still, you kept going. What I remember most is that nursing was never only about medicine. It was also about women carrying tremendous responsibility, often quietly, and keeping the whole place moving. Each of us brought something different to the ward, and together we kept the work going. Looking back, I can see that nursing in America in the 1950s was part tradition, part discipline, and part change. We were still shaped by old rules, but the profession was beginning to evolve. The hospitals were changing, the science was changing, and nursing was changing with it. My name is Betty, and this was my American hospital experience in the 1950s. It was demanding, structured, and sometimes exhausting, but it taught me strength, responsibility, and pride in the work I did. For your reference, The Transforming of American Nursing by Dominique. A table goes into more detail about Betty's challenges.